Hello everyone. I welcome you all to Online Repertory Training Course 2022. The great series from Dr. Ghansham Kalatia sir. Myself Dr. Lakshmi Prashanthi, and today I am going to speak about repertory. So friends, what is repertory? Repertory is Index of Symptoms. It is a book which contains all the symptoms arranged in a systematic order with remedies in it. We have various types of repertories. For example, the Fartak repertory, the Kent repertory, Boger-Bohinghausen repertory, Bohinghausen therapeutic pocket book, synthesis repertory, etc. So, I would like to throw light on a famous quotation said by Dr. P. Skimmon that no conscientious homeopathic doctor can practice homeopathy in a serious and scientific way without a repertory. So, the repertory is a pillar in homeopathy, right? And when a patient enters to you in a clinic, we have three important rules. That is the proper case taking, the selection of repertory according to the case, and the selection of similimum with the help of Materia Medica. So the three important things are the case taking, the repertory, and the Materia Medica. So there are different aspects of approaching in a case. So there may be patients who come to you with the complaints of mental symptoms. Some may come to you with physical symptoms, and some may come to you with particular symptoms, right? So whenever the patient comes to you with mental problems, you have to understand what is the causation. That is the ailments from. What is the stress aspect, or where or when did the complaint start, the complications and the concomitants. Similarly, when the patient comes to you with physical problems, you have to understand what is the area of issue, where the problem is, what is the type of issue, whether there is pain, whether there is trembling, whether there are tremors, and associated concomitants with the problem. You should also look into the desires, aversions, etc. Right? So for example, if you get a patient who is suffering with shoulder pain, you have to look for that in either the extremities area or the neck area. Similarly, sometimes it happens that the patient comes to you with only specific characteristic symptoms, which are also called as particular symptoms, right? For example, the patient comes with a problem having eructations while pressing the painful parts. So we have a very wonderful rubric in Fartak repertory, that is eructations pressing on painful parts when, and we have a very only single remedy, borax, in it, right? So these are the different aspects of approaching in a case. You may either enter into a case via mental aspects or physical issues or the particular symptoms, right? Next we'll focus on what is the importance of Materia Medica. For example, we get a case of respiration with cough. So we took the rubrics whistling respiration, respiration difficult cough with, sleeplessness difficult respiration, cough dry morning, respiration difficult exertion after, right? So after taking all the rubrics in the repertory, we get n number of medicines like kali carb, stannum metallicum, arsenic, lachesis, carboveg, argentum nitricum, bromium, antimtat, etc. And almost all of these remedies have respiratory sphere. So how come we are going to reach the exact simillimum? Then comes the importance of repertory and materia medica, right? So materia medica helps in the selection of exact simillimum. Once you repertorize a case, then you get n number of remedies, and with that you can study the remedies in materia medica using Boric, Allen keynotes or concordant materia medica, right? And then reach the exact simillimum. So that will get you great results. So whenever you get different types of cases, you have to use different repertories. For example, the theory of Dr. Boyinghosen was based on the principles of grand generalization. So Dr. Boyinghosen said, what is true to a part is true to a whole. So he gave more importance to the group than the single symptom, no matter how peculiar it was. So whenever you have to repertorize using Boyinghosen, then you have to focus on the grand generalization. Similarly, Dr. Kent has given highest emphasis on mental generals, followed by physical generals, and then the strange, rare and peculiar symptoms. So Dr. Kent's repertory was used in cases having generals and characteristic symptoms. Then comes the Phatak repertory, the systematic alphabetical repertory. So Dr. Phatak's idea was to generalize a local symptom. It was used mostly in cases where generals are prominent. Specific locations and various pathological generals are mentioned in this repertory. Next comes the Boric repertory, which is the clinical repertory. So it is mostly used in cases where characteristic symptoms are available. The only clinical diagnosis are available. So when you get a patient who is only talking about clinical symptoms, then you have to go with the Boric repertory. Nowadays, we have more advanced versions of repertory. The synthesis repertory, the complete repertory, etc. So the synthesis repertory is the best example of expanded version of Kent's repertory. So any case which is rich in generals and characteristic particulars can be repertorized by synthesis repertory. And as mind symptoms are very important nowadays, the mind chapter is very widely elaborated in this repertory, right? So next comes the complete repertory. This was given by Dr. Van Zandvoort, and it is mostly used in the cases which are rich with physical general symptoms. So these are the various repertories which can be used according to the case. So now we'll look into how to repertorize a case. So the symptoms in repertory language is called as rubric. So when a patient comes to you and says all the complaints in the patient language, we have to convert into the repertory language. And that conversion of symptom in repertory language is called as rubrics. So now we'll look for some rubrics in repertory. For example, this is a symptom that there is severe pain in the upper arm, drawing type of pain. It starts from one part and drags to another part in a line. The pain increases more while raising the arm. So here the complaint is in the arm. And what type of complaint? It is drawing type of. And what are the modalities? It increases more while raising the arm. So whenever it is arm, you have to look into the chapter extremities. Right? So when we convert the symptom in the repertorial language, we get the rubric as extremities, pain, drawing, upper arm on raising the arm. So when we apply it into the repertory, we get only one single remedy, that is Rustox. Right? So now we'll look into another mind symptom. So the patient comes with the trouble of itching. It goes as follows. Doctor, I have this severe itching problem. This is creating a trouble in my life. I am unable to talk to people and get myself involved. I have no issue with this itching, but because of this I am suffering. So here we know that itching is the problem, but the patient is not having any issue with the itching, but yet he is suffering. So we need to understand the patient how he is suffering, right? So we'll ask him, suffering in what way? Further, the patient says, because of this itching, I cannot connect to the people and make my charm. I have to stay away from everyone. I always want to attract people and that gives me satisfaction. I always want to be in the limelight and be attractive. So here we understand that the basic concern of the patient is to attract people, to connect to the people. And because of this itching problem, he has to stay away from everyone. So here that connection, that attraction and to be with the people is important. And that should be our main focus. So when we look into the repertory, we have a rubric called mind magnetized desire to be. Right? So the metaphorical meaning is, so magnets are basically what they attract. Right? So when we look into this rubric, we have 9 medicines. Further, on looking into the Materia Medica, we have to use the exact simillimum. So this is the way how we repertorize mind symptoms and the physical symptoms. Now we'll look into some cases. So this is a case of cough during COVID-19. The complaints are dry cough which keeps on coming at every short interval. There is short cough for a small period of time. The cough increases more while talking. It also increases while the patient tries to go on the bed and rest. So here the issue is regarding the cough. And what type of cough? It is paroxysmal. That is short cough and coming in every small period of time. Repeating in every short interval. Right? And along with that, we get the modalities that the cough increases more while talking. And the patient, it also increases when the patient is trying to go to the bed. So, when we look into the repertory, the rubrics are cough dry, cough talking, cough paroxysmal consisting of short coughs, cough paroxysmal attacks following one another quickly, cough lying bed aggravation. So when we put all these rubrics in a repertory sheet, we get many medicines. And we see here that Drosera and Antimtat are the only 2 medicines which cover all the rubrics. So how come we are going to reach the exact simillimum? Here comes the use of Materia Medica. We have to study both Drosera and Antimtat in Materia Medica. So now let's look at Drosera in MM part. It says spasmodic dry, irritative cough like whooping cough. The paroxysms following each other very rapidly. The patient can scarcely breathe, chokes, cough very deep and hoarse. Worse after midnight. Yellow expectoration with bleeding from nose and mouth. With retching. Deep hoarse voice, hoarseness, laryngitis. So these are all the complaints which the patient has said to us. So here we understand that Drosera is exactly matching to what the patient's complaints are. This leads to selection of Drosera. Thus, the patient was given Drosera 30. And when you read Materia Medica, you also get to know regarding the dosage. So it's very clearly written in Materia Medica that Drosera has not to be repeated every frequently. So Drosera 30, one dose was given and only one dose completely cured the cough. Right? So now we'll look into a case of migraine. A boy of age 24 suffering from right-sided headache since 6 months. So the complaints are heaviness in head. The pain starts from head and continues till the neck region. The heaviness is mostly felt in the back part of the head. There is blurriness of vision during the headache. The pain reduces only after vomiting. There is desire to rest during the severe headache. Right? So these are all the physical symptoms given by the patient. Here we understand that the patient is suffering from the headache which is right-sided. There is heaviness and the head complaints starts from the head and extends till the cervical region. Along with that, there is blurriness of vision and it reduces only after vomiting. We have to further understand the case. So, then you have to ask, how does this headache affect you? The patient says, I feel I might have ate something wrong or did something which I shouldn't have. So it's affecting me a lot. Since that day, I am having this headache. I am unable to focus on my studies. I am trying to clear civil examination and I want to achieve it. Day and night, I have to work for it and that gives me strain. So here we understand that the complaints are due to mental exertion. Further, we need to understand what is the issue behind. Right? So we'll ask, why do you want to clear the exam? So the patient says, as the pain is very severe, I have to be very careful regarding it. I just barely work or move while I have the headache. I just want to rest. My appetite also increases during the pain. And regarding the examination, the patient says that the exam will give me name. And people will then say, see, he is the guy who cleared the exam. I am very much competitive for these papers. I keep on working for it. Now that I have a corporate job, but once I clear the exam, I'll attain my success. So the people will know me by my name. And that's the thing which I want. Hope you understand, dog. Right? So here we got some physical symptoms, some mental symptoms like the ailments from and what is his main ambition. Right? So what we are supposed to do now? We have to make a proper analysis. Like what are the core problem and what is the main issue. And then further, after making the analysis, we have to make the rubrics. Right? So here the analysis is head pain right-sided, Head pain, vomiting, amelioration. The pain is extending to the cervical region. The patient is highly competitive. The head pain is ameliorated while rest, and there is heaviness in the occipital region, and the patient is very careful regarding it. So these are the very important points, and your repertory should have all these rubrics. So now we will look for these rubrics in repertory. So when we repertorize it, we have the rubrics as head pain, vomiting, amelioration, mind carefulness, head pain right-sided, mind delusion wrong done he has, mind rest desire for, mind ailments from mental exertion, mind ambition increased competitive, mind ambition increased fame for, head pain extending to the cervical region, mind amusement desire for, head heaviness occipital, vision loss of vision headache during, stomach appetite increased. Right? So here after repertorizing, as said, we get lot of medicines. But the two medicines which come very close are lachesis and nux vomica. But on seeing the competition, the vomiting amelioration and other important rubrics in the case, this leads to selection of lachesis. And further, confirming it with the Materia Medica, lachesis 31 dose every 15 days was prescribed, and for 2 months. And then the migraine issue was completely resolved. Right? So the Repertory and Materia Medica combinedly work as a tool to help you prescribe using the exact simillimum. So this way, Repertory works as a master tool in the cases unless one has very accurately taken the case and set the symptoms in rubrics. Hope this was very clear. I am so thankful to each and everyone for patiently listening to me. Thank you.